And then form by chop meet me, Ashasiana.
Okay, and you know, me na ho ho akwa ba. Me do nyame ase say onyame akan ye ho. Ifra no pa no nyina na samre so asan dia be hia mu bio. Onyame ayi adom. Emre nyina, hello, ba cha motimi nkan.
Okay.
Nyame peso odi entemre bia no oyesi sepa emayen. Last week nyame ekan ye ho through Dr. Kram Sapon. Ye dusua kama. Enem so nyame ayi adom. Wayi Dr. Okan ene nadamfo. Ya onso ye Frank, omi nyina de Frank. Ya ne dey no omi ne ebehia. Ne ye dusua sonko efa mema akomoden ho. Edo nyame asepa. Na we de ye nsemre. Enti no menche ho no ebe frɛ opani ose free na abompaye. Owi a doctor na yegya amamo. Ti that's baby say wadi wo friends na ne oni abehiem.
That's it.
So niano momiamre yakumasi yamfa ye ho nhye nyame nsa. Onyame kronkron, onyame tumfo, onyame a wode odo na tu wiase fatem. Ta odo no nti ena wiabre wama wonko anim defo wonimu nimu nipa wo bo yen ho nsem wonmu be kyerɛkyerɛ yen wosi wonye bibiara yesi wayi na adi akyerɛ wonko adifo asede ni kabia na yede ma wo don yimu odon wanwaso a wayi na adi akyerɛ ma wonko a ye be kyerɛkyerɛ yen yesota ho kronkron kakafo opofo no wonko yi a womode wapomodin nsem ebre yen chidom etobe bia apomdinfo be kyerɛkyerɛ emanko a yebo hu emanko a abasamtuo bi yemu anu ntia so enkyerɛkyerɛ won de bebai ade e betu asabe mu amahu ni suro bia bi yemu biara no domanko afade domu pakoti bi so na awade kyerɛkyerɛ wonko yi a yɛden enkyerɛkyerɛ sonko be yanin na wonko a no mfra so yenyi apomodin minim se wo kronkron baka wo mo ho ama de wo mo de breyen bia enye sremuka na emumanam se wo kronkron yi na di akyerɛ yen ti ene wo mo be kyerɛkyerɛ yen kan ye ho na bo aye na de ebetie biara na yenye atiefo wirefifo na emum yenye atiefo a ye de beye adwuma no imo ho kronkron ye sense bi san wo mo so na de ebetie biara no enimu ni emfa mo brese ne danko ama opia yanyankwa yedo ase so aye ne sama ye wo Kristo Yesu din mu nti amen.
Okay, me da say edi kind of remember ye nyina happy Sabbath.
Happy Sabbath.
Say Nyankopon adom nti no ye nyina ye ho ye me da atwell mpanimfo ase ye nsofo pani pasabrobe we so anmasada atwell for elders for nyina ase so omama ye sa kwenyen say ye ne mombekasa we also pay mesada men ministry for penny the men ministry for penny anim no your friend no penny Eric upon me does say also auto and safray o hwe nipa mu nyina mokayen me ne madam fo say yembra na nimdie kakra nyakopon edi amayen no yenso yembra na yene nyakopon asori ma emeche saa enimdie no na any kind no say me ne miaminua bema Dr. Frank Kumi ena say ye dwumadie na ene humide na doctor ono so owo adwuma ewo clinic bi ewo Brooklyn enti enche bia me ne di nkomo se enche bia sima be ba ko me nan num no oba be ka me ho na yesa de dwumadie no so atwa so na ansa na mbetwen se minua no ebeba so no me so me obibi kakra mbe se me chere atwa SDA4 ye memei minum se enne eye men's day na ye memei so de mema no ye ne yeda abusuanity enti yeda abusuanity so de na nyankopon de dwumadie bebre ahye yensa eye se yetimi eye na saa dwumadie no so no anke be hu behia pa ye se kamene wo yapomudin nke be ye den nanso obonsam na kwan bebre so ama yapomudin no eho atotwoma na se eho abafom enti dwumadie a ese nyakopon se menu osifa die no yentimi ndi osi yenko amanama nyina so na ekoka na asem na ansa na yebesifa akọ amanama nyina so na ansa na yebetimi etie nyakopon asem na yeba akọka kire amanfo yebe kire nyakopon tumi die ne dwumadie no na ese nki yapomudin eho yeden enu ntie na ewie minua bema Dr. Frank Kumi ene topica yede ba no say the body and the prostate inum say yemu bebre yenim yeka body na mbese ene addition no yeni je shada nimre ba say ye chirechire mu na ye nyina ye ti ase se na be ya yebetimi so akọ na akọ kachara manfo na nyakopon adwuma na yetimi aye na ene sana be kai ye topic no ye say the body and the prostate enti ye hwe ye nipadua na anka ye nipadua no se na nyakopon from the time of Garden of Eden sama nyakopon enwunu nipa no anka ne papa mu pa dia na nke ne se menewo ye yare ni kwan se nka yare ba akokra ni ho a esifa eboyen because God in his own wisdom no created man perfect, like no mistake. Internet can say yeah, transasa guess you need to say Methuselah money Adam and Eve no 900 plus, but there are so many things a course where you knew anymore and then me a higher year pa as men a higher year pa ya bebre ya tell about depression ya ran bebre and yet physical kwa e be mental spiritual nyare bebre high ntimi enko kan Nyankopon asem enti ye hwe the body na the kan your body na the body need the anka e perfect ye pa anka and who no blemish no mistake na kwan ben so ewi anwumre ye behwe okwan ben so ana ya ma your body no aye ehu abafian na say yaredom yama yaredom bebre asifa abefa ye emu ni nyina ejina yenduane di a yedie no enti ohwe ene yare na ni nyina ye diet related problems enti anwumre ebehwe enuane a yedie a emma yetimi yare yewie pe minua be man so ebeka about the prostate no enti onunifobia asem na sasem na yemi de ye pa or say your health is your greatest wealth say ye nenam ye kwa adwuma ye pesika na ni nyina ejina yapomudin ho enti se menewo ene ministry day a Nyankopon ato ne safra menom si yetimi ehwe yapomudin hu ye pa eno ne ye sika no ne de ema yetimi esi ye enti ene anwumre atwa SDA church mumie hwe ekwan be so ana menewo yebetim fa ahwe yan pomudin ye se na be ya Nyankopon frɛ na friend ye nkonkaka asɛm nkyerɛ amanfo no yebetimi aka asɛm ye pa na yeka se health a yeka se or health we be say health now we say health no ye ka say health no cry de ba de na ye ka say ohun ya na say o health na eno nkyere say uni yare bia eno nkyere say ye ka say oh what is the state of your health now eno nkyere say oh mini yare bia na emom the state of physical and mental or spiritual well-being so wa hwe ohuna mu yie wa hwe wa adwe mu yie na afi de wa hwe or spiritual well-being mu yie and what we term health into your body no say na me kan ye no from the time of Garden of Eden till now no mumie hwe nyoma ekoso wo nipa duan se Nyankopon bo ade no Nyankopon bo ade no ana obo nipa adwenen ana obo nipa akoma ana obo kidneys ana obo lungs your friend sa nyoma we organs na sa organs we no your body no ebia ewo role a play ewo your body nim na the big problem pa ewo ase no enimdifo bi eyenhwehwemu no mu se yefa ebibifo a na say black people na yefa black men and say black women na omo higher chance omunya akumayare omo higher chance omunya cancer kokra and omo higher chance omunya stroke impo diabetes enti ye hwe ye dipaduan ma ye were the 3 major killers pa high pa ye say heart disease akumayare cancer kokra and stroke enti sa nyoma miensa yi be say ye hwe hu yie pa na ye ka ho asem minum say ya tia but enuanom ne adofo sa ya rewe pa no ana ekum ye enti na men's day yi se betimi akoka Nyankopon asem a ene ne ye say ye hwe yen adidie mu yie enuane ye die no eno pa etimi ha ye pa enti ye hwe bi te say heart attack no eye akomayare akoma no se wakoma no Nyankopon born no dwumadi a anka wakoma no edie no be se me ba from pan to a level dwumadi no wakoma no dwumadi anka se edie ni se enka se timi pompi moja no se ye bia ka se moja di fru osoro ne ye otwi wad bia ka se moja edi efro ne asan ye mi se manya right term na ni nyina ye se wakoma no ebetimi aboyie nti se wakoma no boyie a de moja no eko o body parts mu nyina na akoma o moja no nutrient wakoma no air supply of body parts and cells no with nutrients name from oxygen and no na obehia say ohunam no ebetimi ayeyi na say so in our day-to-day activities na say ye wonnuane bi nnuane a yedie no nnuane a yedie no bi nye now no yennuane nyina before no mema no fufuo ye maame no me ba fie ne ye yerem ne ye maame no na omanu fufuo ama ye di minka se fufuo nye but too much of everything is bad si ye hwemu a before no pan ye duane nyina koye carbohydrate and also glucose enti efra no pa ebedi fufu efra no pa ebedi ebi a ebenya koko ewia ne apemu anwumre ni asa di fufu enti ukohwa ni nyina ye starchy food say the more ye di sa anuane no na the more your body no so enya sa effect was because starch and adoso the end product of starch ni nyina ni say glucose na dey say sichire enti sa nyoma win enya one day with time na build it up enti bo say usano na o strong pa but yenyi no in our 40s 50s 60s no na afedie ye yemre sa time no na sa nnuane a ye die no take effect ma ewo your body no bo say unama ye say onyare onyehwe enso no obu ahwe esan say nnuane a odie no ama nnuane no enhyeda emwa ye nipadua no ndibo say ye ntini ni mu no na kakran na ye ntini mu esi enti ade echen na ade esa ni nyina no nnuane a ye di na enye no na ye ma ye ntini mu si yenum say ye ntini no so moja na namu ko edeba enti say enti bi ewa akoma no ho ye fra no coronary artery sa coronary artery no dwumadi a edia ne say a supply wakoma no and I say entia ayesa arapo afa wakoma no ho na dwumadi a entin edie ni say e be supply wakoma no with moja na afi di asama wakoma no oxygen ni nutrient enti sa entin no ena ma wakoma no etimi epompe moja no right say ena ma wakoma no etimi eye dwumadi etimi di na ya hwe edidie mu yie ni ekodidi nnuane enye McDonald's akese enwoma enye na afi di ba na sana na yentin mu esi enti se yentin mu si a umonse moja no entimi enkomba bio moja no entimi mfa nutrient na ya home na ya home no eni nnuane ya die na wo moja no me be ko wakoma no ho ama wakoma na boyie no esan sa akoma no mu esinti no afi di sorry afi di o ha unama na afi di wabu ahwe enti enuanum at well as ye mesremo momyehwe yedidie mu yie pa because edidie na yedi no enuanu bi na emwaye se yefa bibiti se drinks juice bibiti se cola ene fanta no no se ye chiro content home na ye dia chirewa anka wa adwene de anka uhu coke na se fanta kra obetwa mu akọ because o share the amount of sugar omodi ye sa drinki na afi de ya dilute no na ye de color kan na de ma na no ma enuanum enye easy sa na no ya me na mo na mehwe mafu ye kase kakram si ye hade hu ye mobo yedidie no mesramo yedidie mba chom mehwe yedidie mu yie pa because edinyare wa na eba ye namboy omo ye research anoma hu say among the blacks no pa no there were over 200,000 people may they call even yabibremu Ghana no omo diabetes Ghana for over 200,000 people and they what diabetes and I say diagnosed with diabetes debia which is a very high amount a situation adoso a situation also the yare brain eba a betimi de enifra and aba a betimi ama kidneys I say a situation ebe say organs na ma fe di at the end of the day no kra no and sha na yakọ amputate online enti kakra me de ba ne say our body no nyankopon has creating in a perfect way but yen ankasa ana yeku ye ho in which way na yeku ye ho ye diet ana yeku ye ho tietimi hwe ye didie mu ye pa anke betimi anyi akoyete say metusala ne te say Adam no because almost that time no now they were eating greens no mudi apples ne green vegetables no but now no me no ye no ye de and na makese McDonald's akese mu ni edi all these things they are not good for our health na make no so about this part of the world now it's more of cancer because in here na canned food processed food and all this processed food no it me cancer draw your cancer no draw bebre anytime we see me the end na wani man kai dan benu for my time pa no anka metimi akodi ma chere cancer draw ye wo any nuane e dia e cause sa cancer no interdisredia na me the best to ye nim e mema ene your duty ye nyuma no yesi akokanya kopon ansem but ye yare a ye ntimi ye nuane die no nuane ye die no ene de sa yare wai eba enti ma disredia pa ne say ye hwe ye didie mu yie because ye didie a nuane aduane bia na esi ye di ye timi go back to the Garden of Eden na ye di green vegetables na ye go back to the green diet na eno be boyen na ya fe die eno be boyen na fe die ye honam na si ye yosun ye me usa me down for Dr. Training Aba na emre bi o tai ka sem bi say ye hwe nantwi a cows pa no o hwe cows a un say omo we meat omo we enambia but omo de bia no na green omo we grass nkwa and so you see how big they are enti ema ye mo show na say nsuro say na say mi jai na mo we na say mi jai all those bad ways of eating na me could di green vegetables nkwa I had na my lean and I say more nutrition na free there my underweight there be antisa in nuane ye here no all the necessary nutrients no ni na nso all those green vegetables no enti misremo mo mi enhwe diet ye na se ehwe diet ya menim se nyankopon so beboae ni etimi anyi ache ni etimi akọ aman so akọka kire o masem enti mede besia na ma Dr. Twene atwaso no wanna wasiesie topic bi the higher ye pan so ye prostate and my prostate menim say yata about prostate no ana fe die abma ya adwenu mu aye na ha ene yenu be ma Dr. Frank Twene wasiesie presentation nice topic obe chere mema prostate no infie ben ye du a yetiminya sa prostate no ana say yesua no ana yetiminya sa prostate no enti mejai kasamu no na medama mia menu abema Dr. Frank Twene na fe de watwa so na the brain about the prostate no watimi ama ye ho.
Yo, medasi Dr. Frank. Yede medasi pi say more atmons monsa frame. Yede me wishimi na happy Sabbath. So Yo, and then you be talk about prostate. Inti Dr. Frank Kasano or can say your body no already boy body no but organs be brave. Na organ ni bi ne ya adwen ya koma ya harawa ya de home your intestines did nuane na digest be so any prostate no so ya dia ni on the surface nti ye hwe body no ho na ugina mirror moon se wo hwe ho a bibia prostate no ehye nti ene ye de ye be highlight prostate na kakra ama yahu what it is and nyuma edie ene nyarewa itimi eha prostate no. All right. All right. All right. Yo, and see, and you better talk about 3 main pathologies and I say nyarwa eha prostate no. Nyarwa no mestati every prostatitis. Now called benign prostate hyperplasia, then prostate cancer. Midin de Dr. Chune Kumi. Yo, nti prostate no a glandular organ. A case de glandular, HSA adeno secrete in nema. One of the glandular organ in any organ ya ema yinya intersui. A secrete in nema. Nti prostate no so a adibia a secrete ensue emain. Na science you know a part of semen no. Nti se bema jano ho oni oba edi nkita ho na ojano ho a prostate no secrete ensue bia eba out. Na ni location no it is nti prostate no anone red ya ewo hai is located below the bladder nti baby a jonso say throughout the day ni nyina ye accumulate urine but we are not at the bathroom ye jonso de bia nti bladder na say tank polytanker store urine kakra na eyema na fi yakwa jonso so it's located below the bladder no. And then in front of the rectum, no, nti ye giant nine no so every no and no anyhow. And then behind the penis no and no nti prostate no ne red one below the bladder, in front of the rectum and then behind the penis. So the function of the prostate no, prostate no, so they may say a glandular organ is secrete fluid. Now fluid na is secrete no, this fluid no help nourish the sperm. Say bema ejane nine ejano hungu obamu and I say yeah, it means 7 days obanu. Now 7 days no, the sperm no needs to eat, needs to nutrients and the prostate no does that no. It gives the nutrients, it gives the sperm no nutrients a bit me amana last that long, about 7 days no. It also aids in the transport of the sperm inside the woman until emphasis a true kakra a ma a whole year through manitimi slide the sperms no it me slide it through obanumu as it goes into a very important organ in terms of reproduction because here say sperm it me lasted long now obanu to kusiana it me ashiano and also in here say it me travel through the pipes no obanumu na it me akushia kusiano so. So the first one I will talk about is prostatitis. So prostatitis is the inflammation of the prostate. With many other things, inflammation to me see. Inflammation, I say, epira. Bibi akoso amene epira. We could have trauma could cause it, but mostly not a bacterial infection na a causal prostate. Inti yemfa say second year child na eho asoa na eyo ya na aye red no prostate no so timinya same symptoms say asoa ahono aye koko na aye ya odon sakoka aye ya pa inti it may affect all ages, men of all ages. Any prostate nibi inti no yeche emema enko emema eyare. All right. So symptoms of prostatitis no ubenya fever inflammation inti humbe shikakra so hun sisi ho so yes Johnson so you feel some burning sensation whilst or Johnson no kujina say Johnson so ya difficult say Johnson in ma opese ba so mana ya ow ansana Johnson no etimi afri umu aba but Johnson be bree so Hwana Johnson do Johnson so Johnson me cloudy kakra enye clear to say enye jealous go hana say nema de mu aye white yellow white shibisa no nti e be cloudy uhwema mu clear you could also have moja kakra ewo urine in tenders in the perineum no nti perineum ni distance say from your testicles no say shwano to your toe and kasano space kakra wo na size space no your friend perineum na honum na hoichi na prostate ni she intino honum be ya obia ho a otina se kakra otina kunwa so ase bibi how unsa obia gro na bibi koye ho a etimi ya epa nti symptoms of prostatitis no ebi no then person mo kai wa hane say unya fever the others no fever ni nti ye no fever utminya the symptoms are can be nyina no utminya with the others are mebobo so actually no nti ye no the fever ever nti ye treating the same normally we diagnose it say obejonso kakra na yahwe jonso no usually it me bacteria na also nti so oba yarisa bia na doctor count symptoms mejonso yellow cloudy kakra me ya me ho aye kakra me perineum hoso so ye me ya say metinase kra na maintenance ye it me wo me ya na doctor no timi kase ne jonso good cap mu kakra na ye nko test it me say bacteria bi na ye who say okay and also you treat you. But the interesting thing about prostatitis they say depending on age no you treat in a different kakra nti mema ye less than 35 no usually say nya prostatitis na na if sexually transmitted more ni binu na akoso amayenya nti bi ni say gonorrhea and as chlamydia na akoso ye amayenya prostatitis no. But then as in fie ko yenim no usually no na by that time maybe I worry maybe nema nti say STD sexually transmitted disease say maybe only maybe breda na unyana so during 30s and above no na san abrabono yes kakra. Usually after 30s no E. coli in the course. E. coli no be one papa hu one dware or 12 E. coli no toilet mu. In that sense, no, one papa who one dware one year something ye na be etimi afa ehun akuru na call prostate. After 30, after 35, no, because of hygienic reasons, say other things like that, no. But under the age of 35, no, because of sexually transmitted diseases, gonorrhea and chlamydia, and also. The treatments, antibiotics, and then antibiotics, so depending on what we are treating, as sacral, but mostly is azithromycin and cetrizone for under 35, and then Bactrim for greater than 35 years. All right. Since I say, you better call benign prostate hyperplasia, no, any prostate cancer, no, as. So these two, so in Yarwa, mema as yinfie ekoyeni. So unlike prostatitis, na itimichi bema biano. These ones, no, it's more a yaria edini na deba. As you age, no, na inema etochimakakra itimi de na soba. Nye mema nyina nenya, but majority enya anuntina ene yebeka ho asem no. So benign prostate hyperplasia, no, so ye picture ye who say prostate ni na normal one ye, but benign prostate hyperplasia, no, ni na I enlarge kama, I ni na enlarge ay kesiye, baby kids will be na kesi. Just the whole thing, no, uniformly enlarged. Now, against the ureter, no, make I say blood and a polytanka, a store urine, na a yema na Johnson, na yakwako Johnson. But because prostate, no, I also urethra, no, efa prostate numna epino. Drew honors a prostate na kesia, it may constricted urethra, no, na the symptoms of benign prostate hyperplasia, no, the main issue is say I do not constricted urethra into urine Johnson into me MSC and call 101. With the prostate cancer, no, so prostate cancer, no, normal one ye urethra no so come in urine needs me the same film called come. But with this one, idea, baby kid to be aswa. Adibi a grow baby kid to be in the prostate, no. Ama a mia against the urethra, no. Ama Tokrona also Johnson from echo 101, no. It's me, yes, I be. In this case, no, it is non-uniform enlargement of the prostate, no. Ode on say so they be called diagnosis, no, but I say doctor didn't say so I apopo and I say poba could be sihona a sugar no hoka crabina esheho. Unlike yena baby a uniform, smooth, round, na ayekesi. So now benign prostate hyperplasia and benign, no, actually say I don't know a non-spreading and I say a non-cancerous. This one, no, a say prostate nana aba juma brana chese a recruit soldiers bibre say mumram na yintmi mintmi a juma or semi, which is secrete fluids, no. It is just non-cancerous enlargement of the prostate due to increasing in number of prostatic cells, no. Prostate cells, no, na a recruit soldiers bibre say mumrana ayinu mintmi yema juma ye mumra memam baby atna na yet me aye juma say, but when baby or the bema atna cells no baby go ha afide or moye ma or moon ya baby intna and now almost say, hey, na urethra cry na so your pipe or your tube. Yemiana kakra na intimi fa suggest kakra ngu hona omumu adwuma ne mame. And therefore it's like it's an increase in number. And see, if I can hyperplasia, no, that is what it means, increase in number. There's a word that is similar like hypertrophy. Hypertrophy, enlargement of the cells, no, which is not what is happening here. And see, hypertrophy, it's say, walk gym, now walk lifting na diesa, na if the wa basa ye kakaka. And no cell, yes, you hear, with microscope no more, and yeah. Muscles be no wenya muscles na ye do wo na oda so but say no omoye akakaka. This one dey in kai the yen analogy and wenya more muscles ni bi well recruit more soldiers ni bi na ekoso. See this so a non-cancerous enlargement of the prostate due to an increased number of prostatic cells. Remember yendru by the age of 90 there na 9 out of 10 men enya prostate hyperplasia. Inti idea as yemfie koyenim no, we tend to then get it. Enye cancerous, enye just uncomfortable, urinating me out inti the hunsin and so beba. But as yemfie koyenim no, we tend to then have it. All right. So now, as I had said before, no, another picture of so the normal prostate or bladder no urine besin kokama urinaka mubu runabout so me enco down because I do not constricting. All right, so symptoms of BPH and benign prostate hyperplasia and say urinary retention. No. Ojonso as a unjonso mbiye Johnson bi kakra aka intino ebema wajonso pi wajonso awie so bare 5 minutes later Johnson signed up because and new Johnson aba just Johnson na ne wo hoda na deal na no just some seconds minutes ago no when it's me and Johnson nyina intino afina for so afina what's how Johnson be because you are trying to empty the poly tank the bladder no na untimi enyin at once. Nocturia you say wada na jona wo sorry akwa Johnson. So wada na jona wo sorry akwa Johnson enye yare normal. Kidneys no are doing are producing urine 24/7. But nti wada na jona is normal so bitimi akwa Johnson. Nti obia on a normal number of doing so say bia oye maybe me that say I'm in time sorry so but maybe I say me dana me sorry so 2 times normal for me but I feel say me if you come and na feel me dana me this am so be 4 times and 5 times now that is now considered nocturia. Nti I say a change from your norm no. I want to make this I say and you say what dana wo kwa Johnson e bone baby but I say they be out dana Johnson 2 times now if there you notice say hey say they say this is sorry be 4 times sorry be 5 times now Johnson there then this warrants say if you are doctor I heard the cause pain with urination nti a honum no urethra no I constricted into Johnson so you are pushing against identity you otage out kakra na Johnson also by a man what say you say oh ye bema de bit me dunja by ye the by as a Johnson into mainstream across into me call say yeah na asinity as na say so this obeying or bono WC ni na what me adjust so egumu so that's what we call the weak stream so now let's talk about the treatment of it I didn't not much the only thing is I say until we then try to relieve the pressure by dilating the urethra and we do that by alpha from alpha blockers. Ebine say psilocin and I say terazosin. These drugs, now I call them the osin drugs. Into here a donidina won't say and they with osin, say OSIN. Say group of drugs no sanomina edino and see what it does say the alpha receptors now will your body no emma nema constricted into emma blood vessels and urethra no kitwa esama prostate na nkasa so squeezing no kakra because prostate no muscles kakra wuma emma no constricted kakra and these blockers no kind of stop the constriction no into prostate number relax urethra no so very relax na if the kind mu adaho ama ninyina ababesin in Johnson and me ababesin akokam. We can also do partial resection of the prostate no nti bit me at the surgery na yakoho ni etwa ehun kakra ama urethra no anya kwan Johnson anya kwan ababesin akọ wano a bit mean the stent so asho into urethral stenting into the I say balloon no I say straw the straw be kwa share urethra no na sa straw no ho edin kakra it may resist pressure na prostate no dey mia no and therefore ema tokro no muda homa Johnson no ebesin ko. Lastly a supplement. Nti obi o ha ompe adrubia okasa me do beto tamsulosin ho na wabri kro na me de menum adrubia menye yi but bia supplement bi obefa. Nti this supplement a natural occurring supplement a friend of lycopene. Lycopene the yefa tomatoes red. Then the man tomatoes red a lycopene a what tomatoes no lycopene a red color na a man tomatoes red no. So it is an extract from tomatoes it's me in a tablet form it's me after a supplement to say the offer vitamin C vitamin D or that kinds no. It's over the counter. It has shown to help. That isn't the main reason why people take lycopene, but then, and I said, FDA is not really FDA approved, but it works. Experiments, but many people lycopene is in the market because many people take it for their benign prostate hyperplasia, and it seems to help. And it's not as good as the alpha blockers no. I know the main key. I know the boy juma. But lycopene will be a person or befa a drubia. Min rodos on the door. Me only supplement we are over the counter. And then when they try lycopene, I say or try a guana. Okay, fine. That is So now prostate cancer. So prostate cancer no a abnormal growth of prostatic cells. Inti say cocram prostate na cocram enye anything new bia enye say adibi free baby e free abashomu there be enye say your cells ni nyina no omu nyina what time a omudi nyini no meaning what time I do. Until they have time to grow and then the time to die. Apoptosis. Na cocram. No cells na. I say cell na they say me pese me forever. And I say me the me woma de biasa. Until omo na space na they are allocated no. Omo adosu hododo. So now they start to expand into other baby nini kwa so mo enyo mo dia so omo awo ma bebre ya na say omo anyina mo nana no maba so mo so mo omo nko this is a dead analogy, but growing old is good. Yeah. So in the cells, when it comes to the cells, we want the cells to grow and we want the cells to die. So new ones can come and replace them. Now can't cram. I say cell no. I say ono de and I say cell no. They say obewo bibiri bibiri than the time I did amano no say ongru no. Nti esa na no hydrogen wa beshe ho na occupy space or hydrogen. Esa no so because the quina edema they were supposed to have gone and died off, and then another new and they are not dying off now. They need a new home, they need a new place to stay. Omo here baby for omo betina because omo nya baby enche baby omo wono why ma na fidie omo to coin omo hu se moja na ba besia kwa no wa hura taru moja no na moja de no kwa ko nya baby na se tokro bi shawa na wako hide wo ho no hydrogen and no friend metastasis. And it says cells now if you let's say cochrome, a free prostate and a free breast and a free baby, I did not grow ama to say up baby. I didn't know how to see quine new home man muja besin kwa no wafuriat na muja ndene kwa guru ha no wasifom oba be sine tent ne na ade wo ho no de hydrogen nyame amon se o meshe ho nti wa beshe ho no hydrogen na anone metastasis no. So this one also, so it says it affects 1 in every 9 Canadian man. See, idea as we age, we have a high tendency of catching it. So it's 1 in 9 Canadian man be a bit me and prostate cancer. All right. So risk factors. The risk factors, number 1, any old age. As we age, na body mechanisms hydrogen kakra. It means regulating money. It means in cell no matter from man if the hydrogen. Family history. Say biwo abusia. Say nuclear family no ntinye se nana ne uncle wofa so wa enya there be say ebia poppy enya bi o grandfather enya bi any o chances so be nya bi no was stroke akra ntinye extended side just in the nuclear family no if someone has one the chance of a family member getting one so stroke. Ethnicity. So ethnicity, it seems say IBB for no a chin kese other race. No, it's not quite certain as why a high yen IBB for no sad but it's me chin. A chin so ye dena so anu aidne say ye be brenas a check ye dena ye aggressive kakra. In general, a bit more aggressive. Diet also seems to play a role. Means kase adwani potin ye na ye but ye hwe ayina bia krobi so a omu edi omu nyina edi nnuane bi no it means say ade prostate cancer high was a kro no so. And I say, the adrenaline ebusa bia ebewo aduane a omudi no because baako etimi to kwan efiri sa kru no so no ujai aduane a odi tama na o sa kru no so a the chances of benya ekofon. We believe say diet also has a component in it, and then also history of STI, so sexually transmitted infections. So it may echo so Emma. Emma obitminya prostate cancer. So now these are the stages of prostate cancer. And as it then grows, it then grows to getting enlarged in the prostate, but hasn't really spread outside. Now, in the stage 3, now I feel it's now spreading outside of the prostate, into the prostatic cells, or more ebre more economy ama now they want somewhere else also more, and they go to the surrounding tissues, no, the organs near there war now they are now spreading into being say the rectum, and I say the bladder near the now almost spread the economy. And then on the fourth stage now they are going distance, just say or more fairly or more baby for and they are going far further away from the prostate, so distant metastasis sana and these ones they can then go to the bone. One popular place na omo epese omo echo. So symptoms of prostate cancer, majority of the time no na asymptomatic. Teacher say unte yaubia unam na woko any ayibia sign bia say bibisa ekoso ewo mu. Dinti America san say na a small dots be ewo and a small cell be ewo prostate num na chese ono de also onkomu bi maybe na or hygiene or no occupy space na prostate no son kakra do son kakra de nti ebetimi agura be grow na say enya baby na afi ka say constricted urethra na honum na ede asem no eba. Until a person can have it for a long time without knowing, without any symptoms. You be quite standing no. Na if you who say, hey, sana some kakra, just say, bibiana a share wo prostate no hunintino, na and affected urethra no emma winya symptoms be. But as when the symptoms start to come there, you can have blood in your urine, say muja ebeba urine kakra, or say bema on your ba AD and paso agrona uja kakra utija umu urinary retention to say ba konano urethra na I constricted into woko Johnson krana say Johnson no be that so one Johnson be and chena was uncle Johnson beam say uja onaya and also to me or yakakra usually ebiana cancer cells ni be alcoholum na ekoha rectum no so I drink kakra ema and also to me enye na dwumaye. And then back pain say prostatic cells no so more case or more air spread na or more air ko babia ya na yachi your spine yachi dompe no ye one of the popular places or more pekopa and no more kwa or mutimi ma inya echiare say wechi oya low back pain. So diagnosis then it me diagnosis ade nti say patient be badness or kind of symptoms na echire it make us say hey dey ma me encheke ayibia ewo yemoja no ma yefre no PSA, that's prostate specific antigen. It is a PSA no sora and mine you say hey yanko any test for fronas prostate ayidi and cause a from na yanko into a work srosa. The deal with the PSA no so say it's not about it's not more about the number no, it's more about the change in the number no. Into say obi ewo PSA the normal one a 3 or the infant say 2 na afi oba 6 months for normal checkup na doctor no nti ye idea at the age of depending on crew hours or any depending on doctor no so no at the age of 50 no obe start a check PSA every time obe try moja bia no obe check a say at the din prostate no the din na nti so check na bia at the 2 na 6 months or sign check na at the 3 year. It's a concerning sign. Say, hey, I don't know the increasing. By a high percentage, I increase here, I increase 50%. But so be the other 1, not over 6 months, not a good 2, I increase 100%. And that is more scary than say will be the every 2 equal 3. So it is about the change in the number, no? The percentage of change, not just every 3. If we 4, a call 5. If we 2, a call 4. So that is how rectal digital rectal examination. See, all hospitals so doctor number try say or the inside before so now they afa so afre say the prostate no ACT. Say the mechanic in the beginning no say benign prostate hyperplasia no na increase uniformly nti aye round increase kese baby aye kese kama nti another the surface so how is smooth, but with the prostate with the cancer prostate cancer na there na aye apapapo nti odensa as a odensa ultimately say enye smooth sir, and that is the last thing we can also do is say ebia ayekesiye all right, but in filia pokwapo bia enchela nye well defined kase emaye ntino ye de panye kakra ebe wo no na ya twin ho cells ni bi na yakọ no wo microscope na ya hwese then ekoso ewo ehon. All right, so then say ye hwena say eba say ebia cancers na ye be manu stage near manu grade into benya 2 different numbers and grading systems. Into stage how big the tumor has grown and if it has spread to other parts of the body. Into stage near say I don't know, it's just saying the smaller the number, say 1, 2, better 3, 4, 8, I don't know, I couldn't. Okay, into so how big the tumor is, the size, how it has affected other, increasing in size, I call other parts of the body now. And 1 and 2 means it's within the prostate hormone. 3 and 4, it is going outside. I start to say, or more plenty ticket or more a move out, and that is not good. That is bad news. It's not good news at all. All right, and then the last is grade. So then grade necessarily how quickly the cancer cells are growing and their likelihood to spread. So then this one is only seen under the microscope. If the prostatic cells it look abnormal, then it's not a good sign. But if they look more like a prostate cell, it's a bit good news, kakra. So the lower the number, the better. So that is how it then grows. All right. So then treatment. Treatment of prostate cancer. A bit controversial. The whole way, reason say sometimes you say prostate cancer a slow growing cancer. That is how you are afraid of from Titi. Oh, I did 20 years. It's say be 60s and 70s. It be cry the full baby once and a prostate I bad man. Sometimes people up to observe. Family sankan. Yeah. If you come and name me, family sankan. That is how some, so some people would just opt to say, and a doctor say, let's just observe it. Sometimes it's slow growing. It may take 20 years, and therefore let's just leave that alone. That is not what is happening lately. Lately, no. I don't know whether the medical doesn't know whether it's from and now what is really happening. But now, lately, we are seeing say it is slowly changing from a slow growing cancer to a fast growing one. Within 5 years, it means it be more echo. Usually, we don't know the entire pen temps but it is something into observation. It is an option there, but it is an option is really a questionable one. A questionable major answer. Say a questionable one. All right, the next one is surgery. So we could just go and then we could just take the whole prostate out. And I say sometimes you could do partial prostatectomy. I bet me I take the part of the especially if it's grade 1 and grade 2 now. You bet me I could take cancerous parts every hole. Nanka there akano. But whenever ASana, just surgery alone will not do. After surgery, here maybe a radiotherapy. Say the radio waves bebro any form of cancer be a pese group ya killing and chemotherapy. So surgery doesn't go alone. You do the surgery and then you go about go 20 rounds of chemo and doctor will be decided number of chemotherapies will be here. And this is to affect like I have said cancer na kokra idea it grew very fast. A whole baby what the chemo does and say adibia a cough fast biano be slow down. You slow be down and say cancer no say on the oba baby and slow down and therefore we halt the progression of the cancer. We could even sometimes even reverse it and shrink it and I say but then the side effect of those let's say other things in our body so it depending on them being able to multiply very fast and have the effects. It been a team maybe almost every 2 weeks and 3 weeks be also maybe may more the red blood cells, not white blood cells are more fighting infection. Almost also need to grow very fast. And so who said be born about more also grow very fast and attack at the bone and then suppress it. But once you're under chemo now, anything that grows fast is suppressed and therefore and fighting infection at the side. And utimine when you chimine and more resources to me a year basaka. Hormonal therapy. So we know say prostate now responds to testosterone, which is a mema hormone. Am muscles, am libido no, am ye do differentiating from a man and these hormonal therapy and testosterone no so respond and a prostate no response to the testosterone to say it me reduce a mema hormone no it me reduce testosterone levels now and also so it me my prostate no young say prostate na say na testosterone na no say a bone in sema prostate no why are they na prostate no cause na or ye nema but see ye chili than if you are na it's many supporters via and then the ebejiro and therefore the prostate no doesn't it's not able to function well and as it grow well as it because we don't want it to grow well. We don't want it has a cancer in it, which is also cancer also. So we don't want it to grow well and therefore we suppress it. And lycopene also is here also. So sometimes this isn't FDA approved, to say it one more time. It helps, but it's not FDA approved. This is on over the counter a year. A person can take or struggle with benign prostate hyperplasia and as a prostate cancer. And so then he would then say, "Min also, min the hypertensive medicine, so min the yes, so min the diabetes, so min the yes, so me natural way, meet me a control and therefore they can go for the lycopene. Ebuana fine, Amwawa, please go to." And take the medicine, and let's stop it because this cancer, known as prostate cancer, is changing, is moving. It was a slow cancer, 20 years, 30 years now, and grew can say affect your life and their life. But to say we are seeing a trend say in about 5 years now, a agency. So lycopene is also an option. All right. So now the last thing is to treat or not to treat, a controversial issue. To test or not to test, PSA. So I think the last about 3 years ago, FDA now I say America had more catch doctors say, am I yen tested prostate PSA no be. Until we call on a normal, regular, routine checkup no. Here in America no, doctors don't have to test your PSA. And to say, let's say at the age of 40, and I say, I might be an mammogram. I might be an mammogram. No, you know, the doctors, almost say mad doctors and test it. See, unless your doctor is a bit saying, no, I want to test. You know, and I said, will you ask the patients? No, then tell the doctor, say, please test my PSA. I want to know what is going on. This was because it was a slow growing cancer, and therefore it was like you could test the 60 or the 70. You could test in 20 years, no, but no, maybe no free more and send cancer, and that's why they decided to say, all right, and a Mayan testing. But as I said, it's changing, and we don't know what is causing it, and therefore it is so it's to test or not to test. It is a topic we are still debating. As of right now, in the American, almost say, in a routine checkup for an elderly man, when 50 and above, no. So when we start checking the PSA, doctor no, and who here so better see. One test, you find out later, to you and make us say, hey, one checking the PSA, no, if you in the cancer, there be. But then, at my clinic, and we believe say we will test you. So it's a controversial issue, and that's we as men need to make the decision. If I were to advise, I would say test. The thing is not slow growing as we need exercise. It's the earlier it me as well, the better. And you're plenty kids. Now I start to say too quite. I know the banasana the high dream be brave. Yo, ye idea na me woma and they say you better talk about no. So the prostate and why I have prostate, and so prostatitis, benign prostate hyperplasia, and a prostate cancer. Mede ayi bema kasahman bema Dr. Frank na what's awesome.
But I say, Bema Dr. Frank Chini, Okwaya Odia Famu, Amiahum about prostatitis and benign prostate hyperplasia. And Yamrano AI a bit, and Bacho, ye be floor no, will be our war question, Biano, Bacho, you ready say a answer any question. Yeah, well, up till I think say 5 p.m. and Bacho, or question, and I say we be never so busa. Yeah, ready pa say you be answer. Me am more question me trauma minia bema. De bia me in the corner you call your presentation say na I am Mr. Busa minia bema because I tell you na number say me ma manfo hu ebi wo ha na ye refisi ebeka. Enti me am busa no na so no so timi busa me ebi wa na ye refisi ebeka enti my first question answer na my own say elder otenso apejanensa. The first question I'm be busa minia bema Dr. Frank Chene say me who say all can also prostate in my me say na my diamonds day na ye wo ye ma me no so so na sa prostate no mema kwa na yom ana say e man so omunya sa prostate ni bi.
And you and me that's for question prostate idea a what mema enkwa emu. Nti yen ntina me kasa no me kan mema mammo ema edino. The later time no be I better talk about nyarewa affecting women there, but then for the prostate no is only found in men, and therefore mema nkwan bit me how more adi.
Okay, me that say. Bacho elder oten bacho bit me we so pejans bacho bit me obusa question.
Yo, Dr. Chinene, Dr. Frank, Mummy, Frank, Chinene, Frank, okay. Yada mwase. Pamcho, me question and say controversial issue no. Say unshare beer what to do. Doctors said the okano oko omowa or no push you dear. But Obeka say me ko check him out obi cheska. Na me ni me say adepa bia so ne boarding. Enti se en hawa normal routine checkup no. Ebia obeye ni say via every other year na say 3 years cause you me hunu sign BNT opa my endoge minim the speed no said the doctor can how quickly it develops and as a grown. Here comes my question say now all can be about diet no. Is it something ubetimi de lycopene na ye counter you know aka woduane ho normally and now say this a woman sign be answer na what could look for counter medication.
Okay, you and a question interesting one. Lycopene no, yes, I said say I know my intos red in color. Nti so udi intos aduane unya lycopene bi. But in order to significantly affect the prostate needed, this may be a amount into basic containment and sana adru ayi. Inti there are supplements ubit me afa ebeboa. And I wouldn't say bia faka ebia say vitamin D and vitamin C often the bia as a means of prevention. Because it's a boy obi or how the not so a boy no perfect obi or how the not so and shadan a boy ka crabby but any kesipi intino I wouldn't say let's use it as a means of prevention. I would just say if you are faced with an option you could give it a try and see how it will help you.
Thank you.
You me that's.
But obi or any question be more time obey to me. But most KG, but me share a new dignity. But obey to me, open obey to me. Meet yourself no busa or question.
Me di kwaku. A friend said, maybe you have no for prostate who esan kwan. Na womo basis ne se impendo do awone wo yire no modano it may reduce the enlargement of the prostate and ya na onne ne yire hon mo say a friend say eno so wa man ko kwan so hyehyɛ ahwea prostate ahwea na ha me na no eno kura na say ya tro
ayi kakra ewo mu. Nti I wouldn't say no crepe fisa, but then we notice say a memo moko kwan so bebre no seem to have just slightly and yes significant cases, but there is a slight ayi kakra no crack kakra ewo mu. Mama nka say no crack kakra ewo mu, but enye major be say ebia obinya na prevent so wunya there be but then just say there is a slight no crack due to the experiments now omo you know and observations omo hwe you know omo hu say mema omo ta kwan so bebre no have a slightly lower chance kakra than a normal guy ebia on kwan so pi.
That's it. But I think say open Eric upon but also up agents I'll be to me about question.
Me that's doctor. My question is if I do so as an ado ebia bema ta Johnson bebre no. Say onu nsuo bebra okoda na nsuo bebra intimi nkoso sa say intimi timi asori be 3-4 times ta Johnson. And I say ni na bia na e fa say post na bia ho yaka. Onu nsuo bebra intimi nkoso be bisa.
It's me also. Onu nsuo bebre nsuo no besan ba out. Nti say what da ebinya no say ene ko Johnson. But then na me can say obia won a normal amount maybe that sorry okojon so. Nti ene maybe let's say obi that sorry now or sorry 2 times no okojon so. Now for the past base be 1 month. Or yeah, I say they did some okojon so be 4 or 5 times so. Maybe manums so still now no some sorry be 4 or 5 times and okojon so. That is when it then comes about. But say in a one setting, na say ene makodi di na manum nsuo bebre na one time be my sorry akwa Johnson be 3-4 times more than I usually do now. Is then there's a reason say nsuo na no me ntina ma me ko bebre no. But if there's no reason, say one nsuo and I own nsuo, but then still na no you end up having to use bathroom no bebre than normal time normal dodo na use na. That is concerning na. Or say okona o doctor na moka ehun asem and mo examine prostate no say bibi ekoso ho.
That's more second question.
Yeah.
Say even say so koisu washu na say ni na ma right away na bia very na fufura san ba biwa. Okay. Say uma Johnson tau too much. Say bia wada na bia to so do pa. Nanso so no say ni henti won so na tau too much ya. And so timi nko so sa say bia to kodun so na bia kem na enche na wasa kodun so bibi sa timi happen.
All right. Nti say o Johnson na bia kem na o san kodun so biem no. There are 2 things I wo. The bladder no bit me aka. Maybe free bladder no na misbehave. And to me as a polytanker, o Johnson be na food na flat na if Johnson nyina afrim. Na as the day goes by now we accumulate water na ema bro so na if a little say kojonso na if o Johnson na squeezing is so there are situations where the bladder na kasano lose functionality in that and some of the thing could be say nerves need be nerves na control bladder say and aka na cancer na ubetimi aye akọ use bathroom bebre free ho say one Johnson be na wasanko betimi so aye prostate no nti no this is a or say oko na ebanisa na oko na doctor examine na yehwe the air cost. Now one of the reasons betimi aka nerves no be diabetes. To be all diabetes no sugar no betimi akotitare nerves no ho ama nerves no ntimi mfaya wano na in cancer bladder and say hey Johnson no airco no contract yekitwa once bladder no still na yekese nti wa Johnson awie kakra bi na buy out buy no so no I say Johnson kakra ho na masan akọ Johnson bi nti no that one no so ewo ehono. But when you are having these symptoms, I would encourage say let's go to a doctor and get it examined and say in free prostate no and I say if free prostate no na yasati edi hu adwuma inten.
That's it.
But I think so penny mic and so but you up down so bit me on me too so now but you question.
Okay, but you chimenka. Okay. Da wasi pa nyame nhyamu na omamo adwuma ne nkoso na ne mo science wo prostate mu nko ano monye sa research man. Me question no every doctor they all kan answer what my opani kwaku a question no. Na I think say you be my assignment. Now what's your further research any reading kakra my. Now what my feedback. I think say a very important question. The entire mama dream who say sabi unim say body no say ohun say bibi ewo mu a ti say dia obo ni say white cells ne na say for chassis produce no say ne yedidi a yenya sugar insulin, you produce insulin just to fight the sugar. So na exercise bia no and say ejaculation ye be free more body no specific me who said you mean simple put no but esoti we are telling the body say make more of that. So it making more of that, you know, so it to me pass we fighting something, and I said we the cells are active in a normal way, but there is a little bit truth about it. There's still a question mark. My question is, I say, can move it to my more research now? And I said, to me explaining is why I say sugar our body in more. The pancreas will secrete more insulin to combat it. Now, prostate in so ejaculation and as if one say we ne sotia those compound as a substance ne sotia the and yet normal say body no ever sign I can say okay, let me replace what is lost. And by so doing, you know, it helps.
Okay, so to get your question, all cancer say yeah, the frequency say bema kokwan so be brain na say ebuano and
exactly. I don't make us say. And so your research can now confirm because there is a little truth about it. But this means little truth no said yeah we explaining no.
Okay, all right. Inti mate o question asi eye pan. Inti said the mekai no prostate near gland is secrety in nema produce nema. So now no benign prostate hyperplasia no say you know it means secrety nema no senena esimi is ne dada no inti a produce more cells more aba more abwa ama secrety the same amount of fluid no. So if you be a kokwansu be brain, the theory behind it say the cells no are efficient at what they do because they need to then produce as often and they are much better in terms of efficiency, and therefore benign prostate hyperplasia no what chances no ever form kakra because it will take a much longer time in your years no for them to now be insufficient in their production no na ama wo ayina start to say swelle and a recruit soldiers bebre ama omo ababeboa. So that is the theory behind it, and say it could be say we are exercising the gland and the gland is becoming more efficient at what they do, and that then is where that slides comes into play. Say yes, observe mema na omo ekokwan so bebre na mema omo kokwan so bebre no yes omo enya yinibi and I say omunya bi but omunya no much later in their years and I say omunya no there was a difference. There was a difference but as we blaming it on just a person kwana okono na man and I say the science no shouldn't mean differentiate as to what is the big reason. But yes, there is a difference between obi okokwan so be brain obi on time kokwan so dey.
Exactly, thank you. But I also think that the more we exercise, the more we become efficient and effective. But I know soon, because I can be the cancer, maybe I find there may be home and that's right. And no and granting because sexual hormones is controlled by our brain, as we know. It be a body be a different dear kakra. And he say be a old journey home be a now anko but muscles are any jumana or it won't tell. And also a cell catcher and say and as I say crana I just saw also in a juma nemer upper home with chum. Indeed, some part of what you say. If
My
you cross
class,
the
you medicine will say either you use it or you lose it, and therefore, and say, oh, you see muscles be once or muscles and a master tape from. I say, Ubi or how your bodybuilder or gym, ye be brave. If you own gym, no. Now I don't know. So the muscles now want to bone in a basin in a sort. So you use it or you lose it. So yes, I did your baby sour, but then it's not a full on guarantee. Say any man or young fast and I am cook one so baby and I say Uncle 3 times a day and I say yes because the whole system also so body in I back. I said well oil machine. Oh focus so have a bria over baby so etochima. And also so idea maybe na mama feedback on it no maybe mu so na mama feedback on so another time.
Thank you.
Okay, I think I have one of few questions because I'm right now. But when you work with John, I'll bet me one more question. I feel it.
A doctor for any question that maybe sir. I saw penny assume no no the casa be a casacqua because for ye penny inti. Na a beer the opese friends what it tuja and then they say yeah money be about platform no so. Say manus wo mushia ya na mo mfasi ho ni bia yesu ya nne fa nkomo platform no so. Na wo mu chire man say oba bia otako afre anadwu bia no nya ne tipaye ba no. On a doctor for na yen solve the teeth pie the man. If you say I'm here on uncle the reality pie no na pack of fire dear so brain. Make you say I'm a friend say Abusiano and what Manuasi.
That's it. That's a very good submission for I hope so much will be any question will be everything is being clarified. Yate the my Dr. Frank training I also be the question be okay very good. But you answer did Jumadi no bebe area no. More question ba ko Emma Munia Bema na pe the bibia area. Say my question is say any specific diet be and I said diet many changes be on my diet more say mesha a bit to me abwa me send a bear minya sa prostate. Me share my diet to me I'm clarifying the me share my diet and I say me share my DDA mu ya me say one you maybe say me ya say me ya a bit to me abwa me pa ema me enya sa prostate ana.
All right. You need specific diet. Say, I did prostate non per se, but say we did the mono with me a lower carbohydrates and I was situate and never be brave because I I'm say I situate and I diabetes a jarry and King Kong or Yadina so I don't quite buy it's me the name of be brave, but it's one of the so say. Diabetes is also one of the risk factors. It's me they say this so edible. It's me ma it's with me a control what did ye say who did ye more fibers, vegetables, also snake say
Carbohydrates.
Carbohydrates no ayina nti di more salad ne vegetables ne ayina bebre yebeboa nipadua as a whole, and helping it as a whole no would also help us stay strong and the prostate must also be strong in general. And a specific one for the prostate you need, and I said there isn't one a year. You beat me, I said you need protein ye eboa prostate no, but helping your body as a whole, eating more fibers, drinking, keeping yourself hydrated, eating vegetables, less carbohydrates, all this, no, and then cutting down on meat. You will be say mTOR, not going to but meat is shown to increase the likelihood of certain cancers near the DDA, and they are inflammatory to the body, and therefore it's Niemasa and yeti yenam we so it's hard to say yenyes kana anka it mean didi say doctor say there be enudi say enam we number ko instead of saying ka ubenya ben enam be 5 near the go o plate so but yeah it is we need to go back to how we used to eat in a young age when there was little let's say little financial and eat much healthy, cut down the meat, eat more vegetables and less carbohydrates, and that would help us as a whole.
But as far as Dr. Frank Chene, nice a food presentation or the amayen. You better actual Ghanaian as the sorry no so I say. You say na my day. Send am di kan kai no yo dwumade bebre ye Yakopon e de yesi abusua no so enti dwumade esi edi no se ma yare e doyen a ye ntimi ndi se dwuma no ye ntimi nkọ aman so nkaka Yakopon asem enti me de adresere de ese mumien hwe ya pomudin yie etimi hwe apomudin yie a dwumade a Yakopon de aman no ye nso ye betimi ni akodi se dwuma enti me ne minua be ma Dr. Frank Chene ye beda mu nyina ma se se mama esa akwanyan se embra monimia ne mombeche apomuden apomuden ho nsam enti a say ana yede ya no ebesi yeda munyina mase enti man ministry penny ada Eric Opon bacho ya no asi yede dwumadi no ebe shonsa
yenso yeda mase bebre okura wona odayase ye na wose yeda wase pa yeda mase se efre mo no mo so mo baye na mo ne ya be adusu ti sei nyame nhia mo bebre nyame nhia mo pa na ye kana emre nu sua ke benya kura nka na sukra wose nka san to so na so esanso ye department bi so ede enti no ye ntimi anto so nyame adma igura afefofo ma ye be san to ye san afem yo na mi se du ba nyame nti obema kwan na obe san a different no so asan beto aso aman nyame nhia mo bebre da masepa samre meja aha ama pastor anasa some penny for some bibi kan se bibi ene won so dia ne na se pastor was so na wapon yen
yo abani ya da mo ase me ko asoda ho ekoye nyama kakranti afi na menam kwa so me drive na me tia na Dr. Frank and okay ne Dr. Chene Yami Ishira Mopa notice ya the mom on a very short notice, but already and I'm also actually come and the other one. When you say at a breath of frost, a certain sapra mobile boy. And you, when Eric may drive into Major Mamma, much near Bombay.
Yo, any Benny or thing Benny done.
But also, there was
any point any.
Oh, my mom pie, Yamima. A Yankopon near bank see. And you may unqua and on fana was suffer, yet that was a power. In Shira, was your boss with the Maya would have green. And you made the woman I befu or addition. Onam wonqua so Dr. Chenene, Dr. Kine. Any a tear for Wamayenya. Udo yenti, ofa kwambi bre so, you many yetre. Neneya tie se ahoden any opebi wo ho a anamon bi etese etuo ne ebetimi atena se ahye odi en monyamo fa dum ye na se fa kai emaye wire mfrida efise ye hu hia wo ye wo japade se obi wo hanso a owo ohaw ene amane bi a owo fam ewo saa kwan yi so a ne ma bi nkoyi ana se agigi a ana wompa wo yare wa yarsa bia ye do wo nyina ye hye wo nsa ya don ko ya on beka nyamsem kire yi hye wo nsa wo abusia ene wo adwuma se hyira won akwanhuduo nyina mu ma yenmu a yetie nsem nso yemfanye adwuma bre sese ye ko check up bre be hu symptoms bi bre bibi nkoyi anampo ye take prevention say betimi atena no ma yemfa enya de hiade pa enwumrei bra wonam dom so ahyira ye damu nyina ne yeso ne se ka yɛn nyinaa yɛ ho baabi a yɛwɔ yɛda wase sɛ watie yɛde yɛ men's ministry yɛde yɛ asɔre dwumadi ahodoɔ nso hyɛ wo nsa hyira no memfiri adom mu nkɔ adom mu bere nyinaa titiri panyimfoɔ a yɛda ano ɛne asafo mma nso a yɛtu mmirika ɛbɛtie w'asɛm ne nkyerɛkyerɛ ɛte sɛ yi anwummere yi ayɛ ni aseda nka wo din